Stop taking your diabetes medication right now, and listen to me. Because if your A1C is 6.4, and your doctor says you're perfect, you might actually be in serious danger of dying. And I'm about to reveal what happened to Robert Say, 76-year-old man whose perfect A1C of 6.4 nearly killed him when he collapsed in his kitchen, split his head open on the counter, and lay bleeding on the floor for 20 minutes with his brain starving of glucose until his wife found him barely conscious in a pool of blood. All because nobody told him that the 2024 guidelines from the American Diabetes Association, the Endocrine Society, and geriatric specialists worldwide now reveal that for seniors over 60, an A1C pushed below 6.5 is often more dangerous than an A1C around 7 to 8. I'm Dr. Barbara O'Neill, and what I'm about to share could literally save your life, or the life of someone you love, because for decades you were told one simple rule: get your A1C below 7, and the lower the better. But massive studies following thousands of seniors for years discovered something absolutely shocking, that the medical industry kept quiet in older adults: the immediate threat of severe hypoglycemia, dangerous blood sugar crashes that cause falls, fractures, head injuries, heart attacks, and brain damage, can be far deadlier than the long-term risk of complications that take 10 to 20 years to develop. And if you're 75 years old worrying about complications that might happen in 15 years while ignoring the hypoglycemic episode that could kill you, tonight your priorities are dangerously backwards. Robert was 76 years old when we met, and he'd been managing type 2 diabetes for 15 years with his doctor, constantly adding medications to push his A1C lower and lower until it reached that perfect 6.4 that everyone celebrated. But something terrifying was happening inside his body that nobody noticed. Late afternoon shittiness, trembling hands, light sweating, pounding heart for no reason. And when he described these symptoms, his doctor dismissed them, saying, "It's just your sugar dropping a bit before meals. It's a good sign your medications are working. Just keep glucose tablets handy and eat regularly." So Robert did exactly what he was told, while the episodes multiplied, until he was waking at night, drenched in sweat, with his heart racing, stumbling to the kitchen to eat something sugary, living in constant fear and anxiety about his blood sugar, while his excellent A1C masked the danger that was building toward catastrophe. Then came the ordinary afternoon that changed everything, when Robert took his morning medications, as usual, ate breakfast at 7:30, and around 2 p.m. was preparing lunch when the familiar shakiness started, but this time felt different. His vision blurred, his thoughts slowed, he couldn't remember what he'd been doing. He reached for the counter, but his legs wouldn't respond. And he fell hard, with his head striking the sharp edge of the counter, blood flowing from a deep gash in his scalp as he lay on the tile floor, conscious but completely disoriented, unable to think clearly, unable to move, unable to call for help for 20 agonizing minutes, until his wife came home and found him bleeding and confused. The paramedics did something critical that no one at the clinic had done during those months of good A1C. They checked his blood sugar immediately and found it at 42, not a bit low, but 42 milligrams per deciliter, a level at which the brain literally does not receive enough glucose to function properly. And CT scans at the hospital revealed a skull fracture and a small brain bleed from the impact that kept Robert in intensive care for a week, and another week on the regular ward, physically fortunate with no permanent brain damage but psychologically shattered, afraid of his own prescriptions, afraid to be alone in his house, afraid the next episode would come without warning, and no one would find him in time. Here's the critical truth that Robert's doctor missed, and that your doctor might be missing right now. For a man in his mid-70s on multiple glucose-lowering medications, an A1C in the low 6 range is not automatically excellent, because large observational studies in older adults show that mortality risk follows a U-shaped curve. Lowest at A1C values around 7 to 8% and higher at both very high values and very low values, which is why the American Diabetes Association and Geriatric Endocrinology Societies now explicitly state that A1C targets for older adults should be individualized, not rigidly set, at the same levels used for younger patients who have decades ahead to develop complications. As an older adult, your body responds differently to low blood sugar through something called hypoglycemia unawareness, where the classic warning signs of hunger, shakiness, sweating, and rapid heartbeat become less reliable, and your blood sugar can drop to 50 or 40 milligrams per deciliter, while you feel only a little off or nothing at all, until confusion or collapse appears suddenly without warning, and this happens because after years of diabetes and repeated low episodes, the hormonal response that triggers obvious warning symptoms becomes blunted. Your early warning system disappears exactly when you need it most, while your metabolism changes with age as kidney and liver function decline, and the same medication dose that was safe at 55 can have a much stronger, longer-lasting effect at 75, because medications stay in your system longer and keep pulling your blood sugar down for hours beyond what they used to do. When you were 50, keeping A1C below 7 made sense, because you had decades ahead, during which high blood sugar could slowly damage your eyes, kidneys, and nerves. But when you're 75 or 80, the XC situation is completely different, because the long-term benefits of ultra-tight control may never materialize, since those complications take 10 to 20 years to develop. Meanwhile, the harms of severe hypoglycemia, including falls, fractures, head injuries, car accidents, heart attacks, strokes, and permanent brain damage, can happen tonight, tomorrow, or next week, and a single severe hypoglycemic episode in an older adult can trigger a cascade where a fall leads to a hip fracture, which leads to surgery, which leads to pneumonia, which leads to death, all within weeks or months. So what do the official guidelines actually say that your doctor might not be telling you? The American Diabetes Association Standards of Medical Care now specifically state that for healthy older adults with intact cognitive and functional status, A1C goals around 7.0 to 7.5% are often appropriate, with careful attention to hypoglycemia risk for those with multiple coexisting chronic illnesses or moderate cognitive impairment. More relaxed goals around 7.5 to 8.0% are recommended, and for very frail seniors with limited life expectancy or history of severe hypoglycemia, some guidelines allow A1C targets of 7.5 to 8.5% or even higher, with the clear priority being prevention of dangerous lows and preservation of quality of life, rather than chasing a number on paper. Let me tell you about Helen, age 78, whose A1C was 6.7, perfect on paper. But in reality, she was waking 3 nights a week in sweats, terrified, stumbling to eat glucose tablets, while her days revolved around rigid meal schedules and constant worry about lows. And when she brought this to a new doctor, who actually listened instead of celebrating the number, he asked for a 2-week log of her readings and symptoms that revealed the truth her A1C hid. Multiple readings in the 50s and low 60s, especially overnight and late afternoon. They reduced one of her higher-risk medications, and her A1C came up to 7.4. The scary lows stopped. She slept through the night. Her energy returned. And she went back to her book club and her grandchildren's games, because nothing magical happened at 7.4, except the balance between benefit and harm finally shifted in her favor. Now, here's exactly what I need you to do right now. Think about someone you know whose doctor keeps adding diabetes medications. Your mother, who's shaky and confused all the time. Your father, who had that scary episode last month. A friend who's terrified to eat. And share this video with them immediately, because what I just revealed could save them from a catastrophic fall or a life-threatening hypoglycemic crisis. Smash that subscribe button and hit the notification bell, because my mission is providing evidence-based health information that empowers you to have informed discussions with your doctors. Drop a comment below with your current A1C and your age, so I can understand what people are dealing with, and hit that like button because every like helps this video reach more seniors who are currently being overtreated while their doctors celebrate perfect numbers that are actually putting them in danger. If you're experiencing shakiness, night sweats, confusion, falls, or constant anxiety about your blood sugar, bring a 2-week log of your readings and symptoms to your next appointment and say this exact phrase: I've been reading the current guidelines from the American Diabetes Association about A1C targets for older adults, and I understand that for people my age, especially those experiencing hypoglycemia, targets of 7 to 8% may be safer than very low targets. Can we discuss whether my current target is appropriate given my age and symptoms? Because your health, your safety, and your quality of life depend on getting diabetes care that truly fits your age, your body, and your goals, not a one-size-fits-all number designed for 40-year-olds. May God bless you, my friend, and I'll see you in the next video.